Hello, Ocean Ambassadors.
Hello, Ocean Ambassadors.
Hi, Ocean Ambassadors.
Hi, my name is Dr. Claire Simeone, and I'm the Conservation Medicine Veterinarian here at the Marine Mammal Center. And in addition to caring for our patients here, I also do research and I work out in the field to help understand how wild animals and their health may affect our patients. And so one of the really important things tools that we use here at the center are patient charts. And so this is an example of a harbor seal named Flufflepuff that we had as a patient here this year. And when an animal first comes in, they'll get a physical exam, so that might entail taking their temperature or drawing some blood or collecting a sample like some fur so that we can understand whether they've been exposed to mercury. And anytime that we take a sample, it's important to record what sample we've taken and record the results, and then we also record all of our observations that we find over the course of the physical exam. And collecting those types of data are really important to give us a full picture of the patient's health while they're here. And it can also help to inform about wild animals and help to look at the bigger picture. And one of the best and most favorite parts of my job is the fact that I get to help individual animals, but I also get to help conserve species and help to understand the health of our ocean.
My name is Carlos Rios and I'm the lab manager at the Marine Mammal Center. And here at the lab we do all the blood work for the animals that we are admitted at the hospital and throughout their stay here and for the release exams too. So, for example, here we have a CBC machine, which is a complete blood cell count machine that gives us information about the red cells and the hemoglobin and the hematocrit in those animals. We had recently a case of a sea lion named Sandstone that presented with anemia that was diagnosed using one of these machines. The veterinarians treated the animal, and in subsequent blood works, just to check if the treatment was working, the animal was released because the animal cleared all the anemia. With the valuable information that we give the veterinarians, the animals get treated correctly and then they get released back to the ocean.
So I'm Rachel, and I'm both on staff here and also an animal care volunteer. My volunteer day is my favorite day of the week. I've always done some kind of work with animals, and this really just sort of keeps me nicely grounded. I wanted to talk a little bit about one particular animal that I helped take care of last week, a big sea lion. And so in this instance, it was a good example of needing to look at the notes that previous animal care volunteers had made in the files. And what we saw was that a combination of things, and they were really good, they were really helpful notes. They were just observations, they weren't interpretations, just this is what we saw. And we saw two things. One was that he could be aggressive, and the other was that he clearly was really tired, that if he was aggressive, he stopped pretty soon. And what that told us was that he was going to be defensive, but he also didn't want to waste energy. So we decided to go ahead and try, and three of us in the pen, three women, and in this instance sometimes women are less threatening to the animals, and this was a good example of that. We approached him really quietly and patiently, taking our time, and we did succeed in being able to give him his full allotment of fluids for that day. And that felt very good to me because that hadn't been possible a couple of days previously. He'd just been too active and too defensive. So again, it was a great example of how a lot of us trying to care for an animal can make notes in a file that are going to be really useful to somebody later on in figuring out what they can do to help the animal.
My name is Giancarlo Rulli, and I'm the Marketing and Communications Associate here at the Marine Mammal Center. I help respond to a lot of the media coverage that we get here at the Marine Mammal Center, whether that's in blogs, TV, radio, magazine, as well as also helping on the marketing side of things, so helping get the message out about the center to different channels so that people can take that information and process the messaging of what we're doing here. And so it's really a combination of both, but we also do a lot of reactive coverage during our busy season when there's a lot of animals on site. We'll get bombarded with a lot of media inquiries, and so I help take the media that arrives here on site behind the scenes and help tell that story of the Marine Mammal Center. This year, one of the big stories that really developed was the outbreak of domoic acid in San Luis Obispo County. And so we had a lot of California sea lion patients that were washing up very sick, many of them having seizures on the beaches in San Luis Obispo and around that general area. One of those patients was Celia, who I have a chart here of the patient, was a female, adult female California sea lion, came here to the center, was treated for about a month using fluids, and once they stabilized the animal, they helped flush this toxin out of the body. And were able to get it eating once again, stopped its seizures using anti-seizure medication just as a human would have if they went to a hospital, and we were able to release this animal back out to the wild. So it was really a well-rounded story, but in terms of media outreach and something that really captured the minds of people here in the Bay Area, throughout the state, and even nationally, this outbreak was something that sure we've seen here for about 20 years, but it's becoming more regular. And so as we talk about ocean messaging and the work that we do here at the center, these animals really shine a light on being windows into our ocean health. So whatever they're coming ashore with is an indicator for what we should be watching out for as well. So I have a little bit of background about me. I actually started out as a youth volunteer here at the Marine Mammal Center when I was 14. So next year will be half my life I've been here, and it's phenomenal. I couldn't imagine more anything else than coming to work here every day and being able to take my communications and broadcasting background and apply it to something that I love and help tell this story of this hospital that I feel such an amazing passion for, and helping get that message about the wonderful work that we do. Every day here is different. There's always a new story to tell. There's always something to learn, and that's what's fascinating. You can never come to work and not think that you're never going to learn something new. That's the amazing thing about working here, is that it's just such a wealth of knowledge and this learning through science as a teaching hospital. It's something that drives me to help make sure that I'm helping tell that story of the center to the best of my ability every day.
Hi, I'm Barbie Halaska, and I work here at the Marine Mammal Center as a research assistant. So here at the center, I help out with the necropsies on site, and what that means is that when there's an animal that's alive on site and ends up dying or being euthanized, it comes in here to the necropsy lab that you see behind me. Here we go through the animal, we do a gross necropsy, and we have certain projects that we like to take samples for. So eyeballs for this researcher, a liver sample for somebody else, and I have to coordinate that in between, kind of the middleman with that, to make sure the samples get collected and then go to the appropriate researcher. With that though, we always incorporate the chart. We always like to check out and see what's going on with this one. So there's an animal that I know very well. The animal's name is Tucson, and she was actually branded on her side. So she had a freeze branded tag, so it's a numbering system. So for hers, it was 2915. And with that, I'm able to talk to the researchers in the field who actually did the brand. They can give us some background information on how old she was, where she was born, and a little bit else with that. And then going into the chart too, she actually turned out to have urogenital carcinoma. So she had cancer everywhere. She had it on her diaphragm, she had it on her liver, she just had all these different nodules everywhere. But I always have to go back to the chart and look through the necropsy report that the pathologist did, just to make sure that I have all the appropriate samples that are necessary before I start shipping things out, and so I can communicate with the researchers in a nice way. I really, really enjoy this job. It's a lot of fun. I really enjoy the teaching aspect. You could have a veterinarian that's done an elephant or a giraffe, but they've never done a marine mammal, and our marine mammals are so incredibly unique that it's just a lot of fun to check them out and explore new things and look at new anatomy with those guys. And then everything dead that dies here, it's sad and it's a little tough sometimes, but it always goes back to the live animals, which is